So, what is your take home from the Genesis conference? You've met a lot of IVF specialists, a lot of doctors in this field. So, what is your take home from this conference?
There's a lot to take home here. The conference was full of very surprising information. You think that you know everything when you go somewhere,
Correct.
which of course is not true.
Yeah.
And the thing that you're inspired by is the fact that you have speakers that came to this location and they share some new information about so many different topics that made it so incredibly important and informative that I'm just, you think that you're a professor and you know everything? Well, think again. I became a student today.
Awesome. Sir, okay, now I ask you some topic specific questions. In what percentage of patients is male factor involved in recurrent pregnancy loss?
I would say probably around 25%. It's a reasonable number. It depends really where you pick up the patients. The patients that come to see me normally are patients that had problems before, and they have really sort of looking for a result as to what they should do. In other words, they're somewhat desperate and they're looking for this is my last stop. And therefore I find a lot of problematic patients, more than an average OBGYN infertility specialist that comes or walks into an infertility setting.
So, what investigation do you recommend apart from semen analysis in couples suffering from RPL?
They need to be tested routinely as far as their genomes are concerned. They need to go and fingerprint it, as we say, and find out whether they carry any particular genetic defects themselves. And if that is the case, obviously, they have to be counseled properly. If they're of age, if they're smokers, if they're drug users, if they're really abusing the system per se, the system comes and catches up with them.
Correct.
And then they regret that, of course. But more of the story is that the DNA that we're given is a blessing and it's a gift. But when we abuse the system, we pay a price for that.
Correct. Sir, what is your opinion on antioxidant treatment in males suffering from RPL?
Well, this is a new area, and the gentleman that described the antioxidants obviously is a friend of mine from the clinic in the USA. That really is very convincing. Now, antioxidants are not just only involved at the level of the sperm, are involved in our general health. So, detoxification of yourself and use of antioxidants as a means via which you can have a healthy life and a good diet percolates all the way down to the kind of sperm that you produce. Therefore, if you have a good life and you eat well and you have a balanced diet and you're not abusing the system per se, more or less you are going to have good sperm. So I tell a lot of people that if you give me a sample of your sperm, I can tell you what kind of abuses you made in your life and what kind of health that you're in. I can tell a lot about the health by looking at your sperm, because the sperm,
the quality.
it's your ability to procreate.
Correct.
And if if you are really sort of living a good life, you're going to procreate well, and so you don't have to worry about that. An example I can use is myself. I had my last child when I was 60 years old.